A question for Dr. Henry. Dr. Henry, what are your views on whether families should remove seniors from long-term care facilities, given the manner that COVID-19 has been a concern in them? And what advice and cautions would you offer to families who decide to take this step or consider this step?
Yeah, I know it's a very difficult and challenging thought for people, and for many families, it's not an option. Their loved one needs the care that they receive in a long-term care facility. So our focus has been on doing everything we can to make long-term care facilities as safe as possible, to try and reduce the possibilities of introduction into long-term care, and having that very low threshold for responding immediately should we have any concerns about illness and, the outbreak protocols. So I think that right now is not the time to disrupt people's lives in that way. And for many people, it's not an option. And the focus we all need to have is on doing everything we can to protect our vulnerable seniors and elders, particularly in long-term care.
Next up is Shannon Patterson, CTV.
Oh, hi, Dr. Henry. This morning, Dr. Theresa Tam made a recommendation for non-medical face covering. She says it's a sensible thing to do. She's saying that it's a bit like covering your cough. Use it when you're on the bus or in a grocery store. You have in the past not recommended this, but she said this was coming at the recommendation of all provincial health officers it was decided yesterday. Were you part of this decision, and do you have any concerns that it would make people sort of back off social distancing or cause any other issues?
Yeah, so I think absolutely I was part of the decision. We have a special advisory committee, and we've been reviewing evidence from around the world around when people are able to transmit this virus. So we did come up, it's not a recommendation. It is a permissive use, if you will, and for exactly the reasons that you say. This virus can't jump 6 feet. So when you're outside, maintaining physical distance are things we know works, and we've seen that here in BC. So there are proven things we know that prevent transmission of this virus. Cleaning your hands regularly, covering your mouth when you cough, not touching your face and eyes, and maintaining that safe distance from people. Wear a non-medical mask, and I can't emphasize that enough, and we've talked about that here. Medical masks and respirators need to be reserved for our healthcare settings and our healthcare workers, because that's where they do the most good. But a handmade cloth face covering that we've seen people using in other places, for short term, they can protect others around you from your droplets. So it's not going to protect you from getting infected with this virus. But for short term, it is a similar analogy to coughing into your sleeve or coughing into a tissue. It may keep your droplets in so that they're not in the air or in the on surfaces around you. It's not an alternative to the things that we know work, but in those places where you might not be able to maintain the physical distance for the whole time, like transportation, for example, or if you have to go out to the grocery store, it is an option for people. I think we need to be very careful not to say that it's required or recommended for everybody, but it is an option, particularly if you're not sure that you're going to be able to cover your cough if you need to.
Lisa Yuzda.
Hi there. Looking, Dr. Henry, at case numbers, and we know that you keep saying very clearly that it's the test positive cases that we're hearing about. Are the numbers of people who are, let's say, coming from other countries or who are being ill at home, how are we accounting for those number of cases? And is there also being an accounting for how different socioeconomic groups are being affected?
That's a really good question. We are not counting those cases that we don't know about, so people who are coming from other countries and have mild illness and are self-isolating at home. We have no way of counting those, and how we will know a broader sense of who has actually been infected in our community is when we have a serology test that allows us to tell who has antibodies, and that's the one that will let us know who in the community has been affected. our focus of the testing, as you know, is on people where we think they might end up in hospital. It'll change either our public health management or our individual health care management. So we're focusing on long-term care homes, on clusters and outbreaks in the community. Some of those clusters do include people who are a close family member of somebody who's tested positive, and we call those epi-linked cases. So we are accounting for those cases. In terms of how it's affecting people in different socioeconomic strata, that is something that we are monitoring. I don't have the data yet. We're looking at it in a variety of different ways, and it's really part of an initiative that we're working on to understand all of the unintended consequences of what we're doing and the measures that we're doing in our community and how they impact different people, not only the disease, but the effects of the social distancing that we're doing and the economic effects and how those affect different people. So those are things that are ongoing in terms of trying to monitor that and to quantify that over time.
Next, we have Jeff Andreas from Radio NL. Go ahead.
Hi, Dr. Henry. You have told us in the past, just how many workers working in long-term care homes have been infected with COVID-19. But have you been keeping track of those, nurses and doctors working on the front lines that have received a positive diagnosis? Nurses and doctors who would typically be ready to work in a hospital setting and provide care. Do you know how many have been taken out of service while they recover at home, and how difficult is that making things for those who are continuing to work in terms of having, maybe longer hours or more patients to take care of? How worried are you about employee burnout and just how many people are in fact coming down with COVID-19 who are working in those emergency care facilities?
Yeah, so the vast majority of the healthcare workers who have been affected have been people who are working in long-term care. And that's where a lot of the challenges have been in a variety of different healthcare workers in the long-term care setting in particular. We have not had a lot of people in our hospital system be affected by COVID-19 yet, so we're not seeing that. There has been some, and I don't have the numbers. We don't actually break it down by where people are working, and in some cases, it's healthcare workers who are infected through travel or through attending things like conferences that we know have affected a number of healthcare workers. So I don't have that data broken down. It's not been an issue that I'm aware of in our acute care hospitals or the intensive care units or the hospital wards that are caring for people with COVID-19 at the moment. But again, that is because we have been doing such a good job here of trying to keep this in a manageable way. So I'm heartened. And we also don't have issues yet with PPE, so people are able to be well protected when they're working in our hospital system so far.
Tanya Fletcher, CBC.
Hi, Doctor. Can you expand on why it appears early on that BC's curve might be flattening while other provinces, especially out east, have been seeing accelerations, especially that in general terms we seem to take similar measures around the same time?
Yeah, I know, and it's very hard to know exactly why. We took a lot of measures quite early. I will say that we took the measures. We were at a lot of the work that we did early on in this. We were one of the first provinces to have cases here, and we spent a lot of time, as you know, doing wide testing, putting out those sparks which were related to people coming in from other countries and bringing this disease with them. And some parts of it are luck, and some parts of it are being prepared. But we were able, I believe, to not have a lot of community spread before we recognized that we had some community transmission and put on the very restrictive measures just prior to our March break. And I think that's a critical thing as well. And part of that is because we learned from Quebec, and my colleagues in Quebec were reporting to us that their March break was 2 weeks earlier than ours, and people were coming back. They have very strong connections, as we know, with countries like France, and people were coming home from March break and getting sick. And so I think, we put the measures on around the same time, but they had a lot more community spread, so they were still catching up. And I believe that's a similar situation in Ontario from what we look at. So part of it was, the system that we had in place to detect cases in our communities here, and part of it was luck, and part of it was timing, I believe.
Next is Vaughn Palmer, Vancouver Sun.
Minister Dix, Wednesday, Thursday, and Friday of last week, you listed off some expectations that the province has of the federal government regarding Canadians returning from overseas and from outside the country. And some of the things you said you wanted to see was a stronger presence at the airport with arrivals in both Vancouver International and Kelowna Airport. You said that there needed to be communicated more clearly, that there should be no exceptions to the quarantine rule. You said the provincial government, the health ministry, needs more information, full information about the people arriving, and you said we need more quarantine space for people who need to be quarantined. I'm wondering, do you feel you've made any progress on all of that? And do you still have concerns, and where are they?
Yes and yes. Yes, I think we've made progress working with the federal government, and in the work that we're doing has involved everyone, the leadership of the Premier, the leadership by the whole government, at the Deputy Minister level, by Dr. Henry and everyone else. So I think we're making progress, and I think they're hearing us. And we're going to work with them to see that change happens. Because remember, it's a variety of sources. There's people coming home via the land borders, and that's important. And every single one of them has to have a plan to self-isolate for 14 days, every one. There's people coming in at YVR, both from international flights, and I think I checked Friday, I think there are 9 or so flights from Seattle, from San Francisco, from Los Angeles, including flights that go to Kelowna and Victoria. So all of that requires everybody to have a plan, and for us, one, to be able to support people in that, should they require such support. But everyone has to self-isolate for 14 days. That's the rule under the Quarantine Act. And it's not just the letter of the law. The letter of the law has to be felt in practice. So I think the federal government has heard us on that, and we're working with them. And I'm hopeful that we're going to be able to let everyone know about that progress very soon.
Next question is from Marcella Bernardo, News 1130.
Hi there. I was hoping to ask the question about the situation regarding lots of groups now offering to source medical supplies. But how do we know that these people aren't scammers and that the supplies they're rounding up are actually safe?
A very good question. I know myself, the minister, get inundated with these. So we actually have a little team, a bigger team now, but a team at the Ministry of Health that is focusing on that exactly. And you can actually, we've now got a website called...
There's a hub there. You can get it through the COVID-19 website.
Yeah, the COVID-19 website. There's a hub, a safe hub that you can put in your offerings, and it gets assessed. And so we have been able to weed out a number of them and actually connect with a number of people who've had some very good ideas and some very good supports that we can use. So there is a team that is validating all of these and also assessing the products for safety, as we mentioned, particularly when there's products that are coming in that aren't from our usual suppliers.
Richard Sussman, Global News. Richard?
So, I'm here. Can you hear me okay?
Yes.
Dr. Henry or Minister Dix, I'm not sure if there have been any concerns similar to Ontario yet in terms of British Columbia being able to get PPEs from the United States. And also on that, what stage in terms of the pandemic framework are we at in regards to the government's policy on how to prioritize the use of PPEs in the healthcare system?
Yeah, so we're at, in that document, we're at phase 4. that's what we're using in terms of how we are prioritizing cohorting and using of PPE in the healthcare system. We don't have any supplies that I'm aware of that have been affected yet by the concerns from the U.S. We are sourcing supplies from many different places around the world, including in partnership with the federal government.
Next question comes from Justine Hunter, Global Mail.
Hi, thanks. And I'm actually also asking about PPEs. I'm wondering if you can tell us how many days worth of supply do we currently have, and what share of the supply that we have received is from Ottawa versus other sources?
You can tell.
Well, we certainly feel good as to supply, but we've put in place, as Dr. Henry has said, measures to ensure that we're using PPE properly so that we extend current supply. As I've mentioned, we've received some supply from the federal government. We've had much discussion with them about the distribution of that supply, and they're very confident in their efforts to deliver more, and we're very appreciative of those efforts and our joint efforts together in that. In addition, we've had some success ourselves. So I can't give you the precise numbers of how many we've received from different sources. We're not talking as much about the sources of supply and the sources of contribution right now, although there will certainly be a full accounting for all that at a later date. But what we are saying is that we need to continue to have the measures we're taking, and we had some success, both as you can see from the report today, on ventilators, and some success this past weekend with respect to PPE. But we have to keep working on that, and we're hopeful that if we can get through these next couple of weeks, which are important weeks, that supply, the world supply, will become better for us. And certainly we have optimistic signs from Ottawa that there's supply coming from there as well. So our efforts have had some success recently, as have Ottawa's, and we're hoping for more.
Okay, we have time for a couple more questions. Next up is Kat Slepian from the Black Press. Go ahead, please.
Hi there. I wanted to ask about the new death in terms of this community. Does that mean that this individual passed away at home? And is there any concern in terms of deaths or cases among younger people in their 40s, 30s, 20s, that sort of thing?
Yeah, so yes, unfortunately, this person did pass away at home and was a known positive case. So that's, doubly tragic for us. And it was a man in his 40s. So we are, of course, concerned about the effects that this virus can have even on young people. We know that there's been some young people in other parts of the country, including someone in their 20s who's unfortunately died in Alberta over the last few days. So it is, young people are not immune to this. Most of the people who have unfortunately died here in British Columbia are people from the long-term care home. So they have been mostly over, with the one exception of a person in their 60s. Everybody else has been in their 70s or older. So it is tragic at any point in one's life, but it does go to show us that even younger people are not immune to the serious effects of COVID-19.
Okay, before we get to our last question, for any reporters that didn't get to ask a question today, there will be a statement released this afternoon with all of the information in it. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Our last question today is from Dominique Levesque, CBC Radio Canada. Go ahead.
Oui, bonjour. Do you hear me?
Yes.
Okay. C'est pour le ministre Adrian Dix. Pourriez-vous nous dire en français, est-ce que ça touche les plus jeunes, ce virus?
Excusez-moi, pouvez-vous la répéter?
Je voudrais savoir comment est-ce que ça touche les plus jeunes. Il y a eu beaucoup de décès de personnes âgées, mais est-ce que ça touche aussi les plus jeunes?
Effectivement, aujourd'hui, la personne qui a été morte pendant le week-end, c'est une personne d'une quarantaine d'années, un homme d'une quarantaine d'années. Et cela démontre que bien que la grande majorité des cas soient des personnes de troisième âge, de 70 ans ou plus, quand même, cela a un effet important peut avoir un effet important sur les jeunes. Donc, c'est important. Il y avait quelqu'un qui a été mort en Alberta il y a quelques jours, qui a eu une vingtaine d'années aussi. Donc, cela démontre que ce n'est pas seulement les personnes âgées qui sont vulnérables, mais beaucoup plus de monde, surtout des gens qui ont des maladies chroniques, disons, qui sont bien sûr vulnérables en général et qui sont vulnérables bien sûr au COVID-19. Donc, c'est la grande majorité des gens qui sont morts, qui sont décédés de COVID-19 sont quand même des personnes de troisième âge, mais cela a une influence sur tout le monde et il faut que tout le monde prenne garde, que tout le monde fait des mesures à 100% qui étaient désignées par le Dr Henry et qu'ils le font quotidiennement. Merci beaucoup. Thank you very much.
Thank you.